Hello, everyone. This is Mark Anthony with AI Edge Podcast, the place where we bring you the best of the best doctors in their niches. Today, we're going to be talking with Dr. Chet Barton. We're going to be talking not just about decompression, but the title today is Why is Decompression Needed Today? Can't someone just go to the chiropractor and just get adjusted? So today, if you would like, you can follow Dr. Chet at Barton chiropractic.com, Barton dash with a dash chiropractic.com. Thank you so much, Dr. Chet, for being
here. Absolutely. Thank you for having me.
Yeah. So tell us a little bit about yourself and how long you've been a chiropractor, how long you've been a doctor, and then we'll go right into the beautiful is why is decompression even needed today?
Yeah, just the cliff notes on me. Graduated from the University of Florida. Been a chiropractor for about 15 years and specialized in decompression right off the bat. And, there's a lot to, the therapy other than decompression, but decompression is a big component of getting people with disc problems and facet problems better for sure.
Awesome. It's interesting. I hear a lot about chiropractic, but I don't hear a lot about decompression. Is there a reason why for that?
Not quite sure. Most chiropractors have a table in their office. A lot of them collect dust because they don't know how to use them. They might not market that they do it. It can be costly. So, depending on the price point in which doctors put it. But as long as you make it reasonable and as long as you teach a patient as to why they need it, go over the research behind it, it's an easy sell and a no-brainer. Improves fluid discal shift, improves facet joint arthropathy, radicular components of pain. It's a clinical game changer for anybody that uses it right.
For someone that doesn't know what really decompression is, I've been been interviewing chiropractors for years, and I always hear mostly more about the chiropractic side. Mm-hmm. So for those of you, for people out there that do not know what decompression is, if you can maybe tell us not just what decompression does, but what it really does besides realigning everything in the body.
The decompression is a form of traction. Medical communities have been using traction since the Stone Age. We used to call it the rack back in the day. It's advanced since then. We have what is called sinusoidal wave movement, or it's based on like computer algorithms. So you get held in static traction and the table gently waxes and wanes. You can do it in the cervical spine and in the lumbar spine. You can't decompress the thoracic spine for the most part, maybe the uppers and the lowers, but not too much. But we usually have disc issues and facet issues in the neck and the lumbar spine for the most part. Simple cliff notes on decompression without diving into too much detail. You lie on a table, you get captured in the thoracic spine and in the pelvis. For the decompression for the low back, you have a simple strap over the forehead. For the cervical spine, you can do either one. Most tables have a setup for both. It improves discogenic issues. It's been shown to improve fluid discal shift. And so whenever you have a herniation, you've got either a spontaneous disc herniation or spontaneous disc resorption. The table improves the environment in which the body is in so that it can actually resorb the disc and overcome a disc pathology. When it comes to facet joint arthrosis or facet joint hypertrophy or facet syndrome, a couple different names for it. It gets those joints gliding like they should. They're planar joints. They move in this fashion. And decompression does a wonderful job of doing that as well. Safe. Only side effect, the main side effect is maybe muscle spasm. And, there's not a whole lot of other risk factors to it other than you can't decompress a spine that's been fused, congenital fusions, osteoporosis, things of that nature. There's some, contraindications for it, but most people can tolerate it pretty well.
How would somebody know if they maybe need decompression? Like I know a lot of people know, okay, I need to go see a chiropractor because, hey, I'm a little bit tight in the back or tight in the bottom. Are there certain types of symptoms? Because those two are the chiropractic side and the decompression side are two different things.
Sure. Well, they kind of go hand in hand, so a mobilization. So chiropractors move people. That's all we do. All right. I mean,
Mm-hmm.
it's a lot of other modalities that chiropractors take on in their practice, and a lot of other angles that they take, bringing on MDs and offering all kinds of services. But when you boil it down to actually the chiropractic side of things, or doctors of movement, chiropractic manipulative therapy, right?
Mm-hmm.
We do high velocity, low amplitude movement, or thrusting into cavitating joints. Decompression is similar because it moves you. It moves you in the axial plane, which is a plane of movement that we don't get anywhere else other than maybe when we sleep and we kind of decompress in that axial plane. Otherwise, all day long, gravity's pushing down on us, scrunching down the axial plane. We move in the coronal, sagittal, and transverse planes just fine. We exercise in those planes, daily movement in those planes, activities in those planes, and adjustments in those planes. Decompression adds that fourth plane of movement, which we don't get anywhere else. And it's phenomenal for you. So it kind of, they work, they marry each other very, very nicely in that way. And so how do you know that you need decompression? Well, most people can benefit from it. Now, depending on the condition, if you've got back pain, if you've got radicular pain going down into the leg, going down into the arm, if you've got chronic pain that waxes and wanes, comes and goes, it's incumbent upon the doctor to figure out why you have pain. There's a lot of reasons as to why you might have pain. And, you can do decompression therapy in a reactive treatment protocol. And I have patients that actually do it routinely just for kind of a maintenance, just like somebody would get a maintenance adjustment.
Mm-hmm. And so if someone, say, is doing decompression, do you normally do it during the same time when you're giving an adjustment, or is it totally different? So like I see a chiropractor at least 3 times a week just because that's just my schedule. If someone is seeing you 3 times a week, would that come with decompression, or is it do you have that on like a different scale? How does that work?
Well, I mean, if you're seeing a chiropractor 3 times a week, I would imagine you're doing a therapeutic session or therapeutic dose or therapeutic treatment plan for some ailment that you've got.
Correct.
Otherwise, you might be in the realm of ligament laxity if you're doing that regularly every week, week in, week out. It's that's a lot of HVLA. That being said, decompression can be on the same day as an adjustment. Absolutely. So, if you've got a care plan that includes a lot of different therapies on top of decompression therapy, on top of your adjustment, then yes. I've got a guy, he's a landscaper. He comes in and decompresses once a month. He doesn't get adjusted. He just likes to get on the table. And there are different strokes for different folks. How I tell people is there are several tools. Pharmacology is a tool. Nutrition is a tool. Sleep is a tool. I mean, sleep is one of the most important tools. The tools that you have, you want to gather as many of them as you can, piece it together like a puzzle, and figure out what works best for you. As far as
what you're saying is that everyone's different. It's just depending on your needs, and some people will need it, say, maybe once a month. Some people that will need it maybe twice a month. It just depends on each person.
Sure, absolutely. And to color in a little bit more of your point, individual variability is a thing across the board for everything that you do. So no matter what foods you might be tolerant to or intolerant to, what medications or supplements you might be tolerant to or intolerant to, what might work for you or doesn't do anything for you at all, it's the same thing that goes for therapy. It's every chiropractor's had a difficult patient that doesn't get better with the protocol that they first initially give them. Well, then you need to step back, reassess, and do something different or refer out, because doing the same old thing and expecting a different result, that's just a silly thing, right? We call that insanity in school. But ultimately, everybody's going to respond differently to the interventions that they choose for whatever kind of issues that they might have. And so it's an educational, it's a moment to take and educate people on that, and then use the tools that work for you, for sure.
When you started getting into decompression, were there any like aha moments? Like what? Not like an aha moment, but like something like, wow, in the sense, wow, this really works. Or somebody came to you they said, doc, you did this on me, and I came in for this, but I'm feeling better over here and over here. This is just amazing. Like, has there been any like stories like that in your
I
15
could,
years?
yeah, well, I've got a handful or more. When I first started doing decompression, Mark, I had to actually talk patients into doing the therapy over and over again because it made them
Wow.
worse. uh, pulley pulley systems allowed for a lot of human error, and so like you've got the DRX 9000, you've got these old Chattanooga tables, you've got this equipment that's older that's been around for a long time. The I forget the name of the original back in the day, but basically it allowed for a lot of wiggle room where the table separates and the cable systems are on the outsides,
Hmm.
and so it increased the side effect of spasm. And you get somebody with radicular pain going down the leg, they can barely walk, they're in an 8 out of 10 pain, 9 out of 10 pain, and you just made them a 10, and you're trying to, then you got to tell them, well, look, this is good for the problem, but it's going to cause spasms potentially. And so therein lies the educational moment to teach them. But once you get a patient going, back in the day, they got better 9 times out of 10. I mean, it's got a success rate of 80 or 90%.
Oh, wow.
Um, in that light, uh, probably the most notable story is, when you get a patient on there and they've got, radicular pain going down the arm and they're worried about neck surgery, or they've got this serious back, pain that's shooting down the leg. And then you can get rid of that inside of 6 visits, 8 visits, 12 visits, and you can really change somebody's direction, because a lot of those patients might seek alternative, more invasive treatments, surgeries, fusions, partial discectomies, laminectomies, removing parts of their body, when in reality they haven't even tried the conservative measures. Because of the severity of the problem, a lot of times they get talked into some of these things when they haven't done the conservative measures, and there's no red flags. If there's red flags, they need surgery. I'm not
Right.
against surgery. I'm not one of those chiropractors that kind of goes down the path of, poo-pooing the medical department. I think there's a time and place for meds, time and place for surgeries, and a whole lot of time and place for conservative care. And the hard part is that it takes a little bit. It takes a little time and patience and consistency, but the track record is there. The research is there. There's plenty of that behind decompression therapy and chiropractic therapy, manipulative therapy in general. But if you're not coupling that with a good exercise, nutrition, sleep, stress management, you're stepping over dollars to pick up pennies. So you've got to include a all-encompassing kind of thing there. But I would say that the most notable stories are the ones where, they are in severe pain. You can kind of change their direction, kind of like your story when you were recommended for surgery, and that chiropractic, generally speaking, helped you.
Big time. And it's funny. That should be the last resort. That's my opinion. The last resort should be surgery. Even if I'll make something up. Let's say you're bone on bone. you know,
Hmm.
you know, I always tell people, you know, get a second look, make sure, and then also, surgery can be good, but there's also like a negative, at the same time. But if you have done everything, you've already crossed off all your X's and everything. Yes, get surgery, period. But so something like yours, you mentioned something about spasms. So sometimes people will get spasms from doing this protocol. Is that just something that just happens? Why do the spasms happen? Or is that just, happen just sometimes, or is it something frequently? How does that work?
It's pretty common. It's less common with a state-of-the-art table. I use the Hill DT. It's based on actuators and sensors. If you cough, sneeze, if you move on the table, it backs off. So
Oh,
it has
wow.
it has a far less propensity to cause spasm.
Hmm.
But it doesn't mean that they're not going to have a spasm. You can
Hmm.
pull, if you're pulling somebody at 60, 70, 80, 100 pounds, you're really stretching the muscles, keeping them in a stretched position. And then when you put them back together, they might move, they might be dehydrated, they might have, whatever type of reaction they have there. And it's most commonly, if it's negative, it's a spasm. The nice thing about my clinic, how I approach it, is I use a power plate. I don't know if you're familiar with power plates, but really nice state-of-the-art piece of equipment. It's a vibration plate. It's a neuromuscular re-education tool that we use. You stand up on that bad boy, do a little bit of movement therapy, a little bit of stretching, and a lot of times those spasms go right away, especially if they're small and acute, or mild, which they normally are.
Okay, so what I'm hearing from you, please correct me if I'm wrong, is that like if you come in hydrated and at least stretched, or maybe I'm sure you probably tell them, I probably want to stretch before you come in, however that works. That could help, but it makes sense to me because you're stretching something. So of course, you get a spasm. I mean, you can get a spasm not just sitting down. I was sitting down this is no joke. I was sitting down yesterday, no joke. Sitting down, and I play a lot of pickleball, so I play 5 days a week. And I'm just sitting down with my computer, just whatever. All of a sudden, it felt like there was like a little gerbil that crawled up my darn leg. I was like, what the heck? It was starting to hurt. I'm like, oh shoot. And I was like kind of trying to get it, kind of pull it out like that. And then of course I threw a banana in my body real fast. And of course it went away like in 60 seconds. But my point is, it was literally like, I was like, what the heck? It felt almost like it was like a spasm, and it was hurting. And I'm sure you don't get the whole that type, but that would be something that's normal because you're decompressing something. Am I correct?
Yeah.
Yes. So it's not.
Yeah. Yes. It's it's the most common side effect of a chiropractic adjustment.
You're right. And you mentioned something that a lot of people don't talk about. Sometimes you'll go through a little bit of pain, but what's the after effect? See, for me, I realized, what, and this is just weird. If I'm getting adjusted or something, sometimes you'll feel a little pain, but it's funny. It's like after that, it's like, man, that felt so good. It's that after effect relief. So in a way, you did mention something about, well, sometimes you have to go through a little bit of pain to kind of,
I try to minimize anybody's pain from therapy, with the order in which you do things, which as well as the initial gradual protocols that you can set forth. So you pull them at a lighter weight and you gradually increase. You pull them at a algorithm that's gentler and doesn't separate as much. There's not as much of a swing in the pull. Include myofascial work, electrical muscle stimulation. These are just modalities that most common practices will have to help bridge the gap between doing therapy that might have a little bit of an offsetting side effect, and then getting them to leave the office in better shape than when they walked in. So that's order of operation. I'm not going to decompress somebody last with a disc problem. The first thing they do when they're walking through the door, they sign in, they're going to come in, they're going to get on the table, and we're going to start there.
Okay. So how would this look? Somebody comes into your office, like what is your protocol? Do you just see them for 5 minutes, 10 minutes? What's the protocol when somebody comes in? I'm sure, of course, they probably do it on the internet. They're the secretary, they do all that information. But once they see you, do you just sit down and you just kind of go through an entire history? How does that look?
I'm actually a pretty unique one shot. I'm a pretty unique practice. I don't have staff. It's just me. So, as far as the intake, as far as the initial, as far as the exam and history, I do a very thorough, I'll spend an hour, 2 hours with a patient. And if they need therapy, which a lot of people do, it is the shortest number of visits that I can give them that I think that I can get them better. Research will tell you that you should be doing 6, 8, 10, 12 sessions. How do you know where a patient's going to be in 3 or 4 weeks, let alone 8 weeks, 20 sessions, 12 weeks? That's nonsense. You don't. And anybody that tells you that they know where a patient's going to be at that time frame, they're lying to you, or they're trying to sell you something. And so My approach is unique. I work in a personal training gym. I've got my own setup there in my own couple of rooms, and I love it. It's beginning to end. I might see 2 or 3 patients overlapping each other every now and then because somebody coming in for a quick adjustment. But most of the time, if I'm doing therapy, they get my one-on-one attention for everything that they do. And so I pride myself on getting patients better as fast as possible. And I see it clinically and I read it in the research. Anybody who's doing outside the lines of 6 to 12 sessions right off the bat before making another assessment as to what to give them and what to prescribe them, I mean, I think that it's more of a money grab than anything else. And I'm not poo-pooing the profession, but they're pretty notorious for doing it. I've also worked for doctors who wouldn't sell anything less than a 24 or 36 visit treatment plan. And you're fresh out of school, or you're just working to try to make ends meet, and you're doing whatever you're asked to do as an associate, and you just learn the ropes, and sometimes you learn what you don't want to do moving forward. And then in my older age, I read and I educate myself, and I follow through with better practices. I mean, they call it a practice for a reason, right? And so hopefully people are getting better at it as they go. um, so what it looks like for me is beginning to end, it's initial eval consultation. I adjust people on day one if they can get adjusted without imaging. Sometimes I refer out for imaging if I need to.
Mm-hmm.
We bring you back in, we go over treatment protocol. A lot of times I'll do it on the same day, the first day if I can, but the second day typically we'll have insurance verified and that sort of thing. And then we'll go through the motions of what I've recommended. I generate a whole patient educational packet for them, depending, based on their the presenting illness or the presenting condition.
Mm-hmm.
And then we get them moving forward, and we get them started right away on that second day. And I'll spend, I mean, I had a guy this morning, just started yesterday, came back for a second visit, and he was with me for about 2 hours.
Oh, wow.
Well, he's got a reoccurring disc herniation. So he's got 15 years ago, he was injured. It's flared up on him 2 or 3 times since then. He's done decompression with success in the past, so he was able to, jump on board with it. The educational piece was a lot easier this go around for him. He understood it, but ultimately he's got a reoccurring chronic disc problem. So I don't know if you know this or not. You had an issue with a disc in your low back, I think you said.
Oh, yeah. Split
And
disc.
so about 66% of the time discs heal. So it's called a spontaneous disc herniation, and the body tries to resorb it, and it will most of the time in 66-70% of cases. Okay. There is the latter, percentage of cases that remains problematic, recalcitrant, remains permanent. And so, he's got, unfortunately, one of the latter cases, more than likely. But he's going to do great. I've prescribed him 8 sessions. He's going to come in. He's following suit with the exercise protocols that I put forth for him. Then we go through them every day in the office, and he's already doing better. So
that's awesome. And that's the way that you're talking is becoming, and I hate to say that, but it's becoming almost like a lost art. And it's simple. People. Healing people. I mean, God gave us these 2 hands to use this beautiful energy from us. I don't mean energy as a new age energy, this beautiful energy. And sometimes we can go after the dollar signs on, oh, we can do this, we can do that. Not saying that those won't help, but really focusing on people. And I think it's getting back to the heart of that. We live in a time that everything is so fast, and there's this new this and a new shiny this and a new shiny that. You follow suit trying to go after that, which is very hard these days. For your practice right now, I know you do decompression, chiropractic. Are there any other modalities that you also do, and just other, I'll say the word niches, okay? Niches that you're really passionate about?
I've worked for a lot of clinics, and they had a lot of niches and a lot of passion. I don't ever see them as passions for these people. They're doing these dinner talks, and they're selling these patients on on these new innovative technologies that aren't backed by the literature in the slightest. So chiropractic has this notorious way about the profession to kind of latch on to the leftovers, to latch onto the crumbs that is left behind from pharma and the AMA. And so, you know, are they doing cutting edge therapy? Maybe, because there's literature that might come out and support what they're doing, but there's no literature out there that's supporting what they're doing right now. You know, when you look at light therapy, there's evidence out there that'll suggest it doesn't go past the skin. It penetrates maybe surface muscles at best. You know, you're not doing any type of joint rehab with lights. It's not there. There's no there in the research. When you look at stem cells and exosomes, there's not a single FDA approved exosome treatment for anything. Some doctors will say, well, that's because they haven't tested it yet. Well, I mean, yeah, they have. They've looked at all kinds of things with exosomes and stem cells, and there's over 1,500 case studies going on right now, research studies going on right now. So they're looking into it. They want it to work, but when it doesn't work, they have a high bar to clear to make sure that it's efficacious, make sure that it's going to actually produce the end result that we say it's going to produce before we sell it and get it approved by insurance, and make sure that it's flipping safe, right? And so, you know, when you're talking about, you know, niches, I mean, I got friends out there doing, you know, biohacking, longevity stuff where they're doing exosomes as an IV and saying that it's like changing it's like an oil change for their blood, and they don't know what they're doing. They don't know how it's going to affect them long term. They don't have any idea because there's no research that has been done for that. It's a sad truth, and it's scary because the FDA can't crack down on a clinic doing it because their hands are tied. It's like whack-a-mole. They'll go after one clinic, another one will pop up, and so they don't expend that kind of resource and that kind of energy to make sure that these patients or these clinics are not doing harmful things. But the only way that they typically crack down is if they're actually claiming that they're treating something in its specifics, rather than some vague terminology, which is what you see. You see vague things. If you ever have somebody, you know, doing stem cells and offering you stem cells or something along those lines, and they don't give you definitive research and answer your questions, and I hope you have them before you spend $5,000 on an injection, you know, then you might, your spidey senses might want to creep up, right? I'm not trying to throw anybody under the bus. I just don't like the profession giving the profession a bad name with doing therapies that haven't been approved by the FDA, haven't been approved to treat any such condition, and haven't proven to be safe. You know, my niches revolve around evidence-based therapeutic exercise, which it's the largest tool, the largest hammer you can swing. It's the biggest bat you can take to the field to get people better, is movement therapy. It's improving somebody's muscular tone, improving their lean mass, improving their body composition. You know, nutrition, you can't exercise your way out of bad diet. You know, these are fundamental pillars. Good sleep, it's monumental in the way you heal and the way in your health. And then good mental health. Those are fundamental things. If you're not doing those things, you're stepping over dollars to pick up pennies. Now, I'm not poo-pooing what I do. I'm not minimizing what I do as a chiropractor because I think it's valuable. People get into a rut. They'll get into trouble because they haven't done some of those things, and then their bodies start to break down. And we can help bridge that gap and get them back doing, you know, what the body is meant to do. We live longer now than we've ever lived, mainly because of pharmacology, mainly because of sanitation. And so, you know, our bodies are starting to break down, and they break down in their 30s and 40s, and then they get worse and worse and worse. But if you take care of them, you can age well. I know plenty of older people that have aged well, and I know the majority of people that don't age well. And there's reasons for that. So I look at myself as somebody who likes to bridge that gap. make sure that I educate people. And so my niche is probably the exercise piece, the decompression piece. I love chiropractic manipulation. I don't overdo it. If you want to get adjusted because you've got a chronic problem that needs tuned up routinely, I think that's valid and warranted, and that's actually backed by the research. Chronic low back pain is very much handled in a good way and reduced with chiropractic manipulative therapy regularly. Acute low back pain, just the same. Headaches, just the same. Neck pain, you know the drill. You've been, down the road, and so you know this. And you talk to all doctors, and they all will agree. But when you branch out of that, when you branch out of the fundamentals and the movement therapy, and you get into this gray water, this gray space where there's no proof of it, there's just hyperbole. There's they're dancing around some of the facts because they don't have any. There's nothing that they can hang their hat on, but like soft wave, it's been approved for second degree burns in hospitals. It's been approved, FDA approved, right? That's great. It's got a mechanism of action. It's been approved for that thing. Chiropractors grab onto that dang thing, spend $100,000 on a machine, and sell it for every soft tissue problem on the planet. We'll do it for your plantar fasciitis. We'll do it for your epicondylitis. We'll do it for your back pain. How do you know that it's helping? Just because the patient says that it's helping, the patient could be doing all kinds of other therapy too. So you sold them on this big package for soft wave, which is whatever, right? But they're also doing adjustments. They're also moving. They're coming to the office. They're getting out ahead of their condition. And FYI, their body was probably on the way of healing anyway, because we want to heal. Our bodies want to be in homeostasis. They all heal. Most back problems get better within 2 weeks, and then they don't come back. Most back problems, most flare-ups, that if you look at the evidence on back pain, most of it will just resolve on its own with no intervention. Now,
I'm with you on that.
So
it makes a lot of sense. People don't talk about that. Like, okay, you do shockwave on. Let's say I got some pain in my back. Shockwave, soft wave. I hate the word shock because I get hurt. Okay, soft wave. Okay, we'll make it happy wave, whatever. So if we're doing something like
shockwave therapy turned into soft wave therapy, so the extracorporeal shockwave was painful, and they modified the therapy to be less painful.
There we go. But here's the thing: just because I'm feeling good at that moment, that really doesn't say it. What I would like to see a video of. Okay, I feel great at this moment, but we're going to see if I still feel good in a month from now. Let's push it and then do a before and after video. I'm just saying, because what they're going to tell you is, well, we need to stay consistent on it. And so we need to do 12 to 13 to 16 treatments to stay on consistent, so that the electro waves, I'm making this up now, the electro waves and the acoustics go through the bone and it starts to heal. See, I can sell it. I hate to say it, but it's.
And people because they want the new wave technology. They want to believe that they can get better with these modalities. They don't want to do the work. That's the downside. If you were just, and the kicker is, Mark, is that the bar to entry, the bar is way down here as far as exercise therapy is concerned. And so food, nutrition, when you think of the benefits that you get from 2 non-consecutive resistance training days a week are monumental and far outweigh any of the therapies that any clinic offers on the planet. And that should be first order prescription. But it's not, because doctors want to make money. I get it. And I'm all about making money. All right. I want to be able to keep my lights on, support my family, and all that fun stuff. But at what moral cost am I going to do that for? But in all consideration, if I can teach a patient and they can come on board and they commit to what I am offering, teaching them simple floor work, teaching them stability work, versions of dynamic neuromuscular stabilization, things that can help just get them to to pre-injury status, and then allow them to make that choice, allow them to make that leap to start with a personal trainer if they want, better their diet, get on a good sleep regimen, and start tackling some of these gigantic levers. You've got 4 gigantic levers, bigger than any other lever that you've got in the health field, and we don't talk about it enough. We're too busy selling decompression, selling soft waves, selling stem cells, selling adjustments. I sell some of those things, and I use them because patients get into trouble and they need them because they're not healing on their own. They're not able to exercise because they're in so much pain. So intervention is needed at that time, and then but the educational piece is being missed, and I think that it's all too common. They're getting over prescribed things because they were probably going to get better with something with less treatment, less care, and something a whole lot more conservative and stability based and strength based. And that's just, that's kind of where
I agree. I agree with you 100%. It's funny because being an ex-tennis pro, and now I'd say the last 5 months I've been staying consistent, working out and eating right, and I noticed the difference. It's funny. I was looking in the mirror the other day because sometimes you're working out. As you get older, it's harder to see. It's harder to see definition. It's harder to see this and that, and then and I'm not bagging on this at all, but you see a lot of guys that are ripped and they're talking about I got TRT and I'm doing this and I'm doing that, and I have nothing against TRT. Okay, I know enough to get in trouble.
TRT and not TR plus T.
Yeah, there's a difference, major difference.
Replacement is physiological norm, and then you go TRT plus, and you're hitting 1100, 1200, 1300 milligrams per deciliter of testosterone in your system. Now you're doing steroids.
Well, you're going to do burnout. Let's just be honest. Just look at Arnold Schwarzenegger. I mean, he was so freaking huge. Now you can barely recognize him. But the point is that if you're not moving, if you're not doing something that's productive, you're going to start to feel pain. Like, I've been very blessed. I'm going to turn 50 this year. Very healthy. Like I said, I play 5 days a week, 3 hours a day, and then, have the gym. So very proactive. Some people say, well, that's too much. Well, I still feel like I'm 20. Okay. I may not move like I'm 20, but I still feel like it because I'm very competitive, but I'm thinking that you've got to have, there's an edge in everyone. And I don't care if you're like, well, I can't work out because of this, that you're making an excuse. You could do something, buddy. I don't care if it's 10 minutes a day, 5 minutes a day. Guess what? That 5 minutes will turn into 15 minutes. 15 minutes will turn into 20 minutes. It's just, we don't realize the capability, and the body was created to heal. And if we don't have decompression,
these people get into a spiral. They get an injury and they avoid it, and they keep avoiding it. And they keep avoiding it.
You know what? You're right. So I'll give you an example. I like I say, I play a lot of pickleball, do tournaments and stuff like that. Yeah, just a little bit. Yeah, but I'll tell you what, totally different, bro. Totally different. It's not. I wish. If so, I'd be destroying. I'm having to tweak my entire game now because of tennis. Because I have that tennis mentality. It's long swing. Now I got to do short swing but powerful. All this weird stuff. So with that being said, when I first went out there, I noticed that a whole bunch of people had a bunch of wraps on their arm because of pickleball elbow, their knee. And they're in pain and they're playing. Okay. That's why I was like, if I was a chiropractor, I'd be out there playing with these guys. I can help you.
Yeah. And
seriously, no, for real. I would. I really would. If I was 20, I'd go back and I'd do chiropractic school. I would have fun, but neither here nor there. What I noticed is that when I first started playing, I kind of overdid it. And so I started getting pickleball elbow. I was like, son of a gun. The pain was so bad. I couldn't, when I go to bed at night, it'd wake me up throbbing. Yeah. And then I had some doctors, you shockwave, man, soft wave. And you need to do acupuncture, right? Not against any of that. But I did something that doesn't happen a lot. I used my brain and I said, what can I do in the gym to strengthen all the muscles around that? Mm-hmm. So I started light training. Guess what? It hurt. That's why sometimes I say pain's good, because pain gets you to non-pain. So I was doing light things, boom, boom, boom. Now I don't have any pain. Why? Because I strengthened all the muscles inside it, and then I started to strengthen the core of where it was. And now it's
You
like I'm
increase
like
your capacity.
100%. So now I'm like, just do it yourself. So when I see these guys, I'm like, this is what you do. You're not gonna listen to me because it's gonna take work. I mess with them. I got you. Gotta sometimes you gotta offend people to get them to do it. Say, no, I can do it to help them.
Sure.
You know,
But I mean, doing prehab and rehab on an elbow is boring. Getting people to do it is hard.
right. But if you're a fanatic like myself, I gotta play all the time. It's a bummer. But my point is that what you're doing is you're focusing on the whole body, and you're focusing on that spine. And if there's inflammation, it gives you an idea of what you need to work on. And you're going old school. And this is funny. Old school I called is the new school, because we've gotten away from the old school. The reason why, when I first heard the chiropractic story, I was freaking amazed. Like, a lot of people don't know this. I'll tell you what, there was only one person. I've interviewed so many people, and I took a 2-year break, but I would say I've done altogether maybe 450 podcasts. And out of all of those podcasts, only one person told me, out of all those podcasts, the chiropractic story of Dr. Palmer, about how the guy was deaf,
Yeah.
came in just for an adjustment. And all of a sudden he can hear. I mean, that tells me we're barely still scratching the surface on chiropractic. That's my opinion, of course.
So if the adjustment clears up some type of neurologic deficit that has created a symptom, then yeah, there are a lot of case studies across the world about things like that. You can, get on YouTube, you can look into that, and it's a thing.
Right.
But individual variability is a thing. And so when you have one-offs, case studies like this, it doesn't mean that that adjustment's going to do the same thing for everybody. So you're not going to take somebody with hearing loss, adjust them, and poof, they're going to have hearing. I mean, otherwise chiropractors would be, in every hearing center in America and around the world.
Bingo.
So, cases like that, cases like, oh, I got a low back adjustment and, irritable bowel was better, or I got an adjustment and my headache just immediately went away. Everybody's a little different. They're going to respond to it differently, depending on what's causing the ailment, depending on what's causing the suppression. And if the adjustment kind of helps that out, then yeah, you can have those one-off types of scenarios. But it's not something that you can go around touting and
No, you can't.
go around saying the adjustment does this, unless it's been proven to do it, or at least the majority of the evidence, the cumulative evidence, kind of points in that direction, which is why, we look at back pain and mobilization to help with headaches, and because that's where the evidence leads us. But yes, you're absolutely right. You can hear these one-off stories like the Arnold Palmer, like the BJ Palmer and the DD Palmer stories, where there were case studies like this. There are doctors out there that'll tell you case stories after case stories because they're 80 years old and they've seen, hundreds and hundreds and hundreds of thousands of patients, and so those stories are there. They're just ends of one. They call that in research.
Right.
So,
but the reason why chiropractic works, though, for my opinion, this is my opinion, is that when something works, it's going to be well known. So, example, we have a lot of hospitals now. They're starting to have chiropractors in the office, which is really cool. That's fact. That's proven, if that makes sense. You don't see.
Yeah.
Exactly, 100%. But I mean, you don't hear a lot about stem cells. I hear a lot about it, but you don't see a lot of doctors using that in like big hospitals. I saw it in a video game. Huh?
They won't do it. They're not going to, because any MD that is following evidence-based practices will tell you that stem cells are they're not approved for anything because they haven't been shown to do anything other than what they've been approved for and shown to I can't speak behind what I believe they're being used for wound care primarily. and that's
Yeah.
about the only thing that they've been approved for. So burn victims, cancer patients
Right.
who have needed severe mastectomies and have wounds from that, and they're healing, and the chemotherapy makes their skin brittle. And so there's a lot of use case for it right now. But I mean, yeah, if you want to collect your kid's embryonic, stem cells and freeze it for a later date, maybe they can use it in the future for them, maybe. But right now, selling some poor 50-year-old with back pain shooting down his leg, or some guy with knee problems, and you want to shoot him up with some stem cells for, 5-6 grand, you're just taking his money, and he's buying hopes and dreams, because if he gets better, it's likely placebo, because that's a real thing, and he's doing something new, and he's going to have that mentality going in that this is going to help, and that's ultimately going to help him get better. And then he's also going to be doing other things, hopefully, and a lot of times these things just don't work flat out. So,
And if so, how long?
but yeah, so you'll never see an MD doing these things, because they follow a guideline that things need to be shown to be ethical, moral, efficacious, safe, before they literally take a hold of something and implement it. Now, they can do off-label things, because maybe in the research they had a secondary thing that was shown that it had this benefit for example, obicetrapib, a new medication coming out for lipid management, has been shown to help with maybe Alzheimer's. So they're going to be watching for that closely, which is awesome.
Right.
That prompts more hypotheses, and it prompts more research. And so, it's got to go through the rigmarole of getting approved. If it's not done that, an MD who's not semi-retired, just signing off on some documents for some chiropractic clinic to make some extra money in his early retirement days, they're not going to be doing that sort of thing. You would see orthopedics doing it left and right, because it helps and it works and it makes the money, but
Right.
they're not doing it. They're doing double spun PRP. They're doing HA, which hyaluronic acid works. It lubricates the joint. Double spun PRP with HA has been shown to be even better, because it just, creates a healing environment. Some people will, say this, that, or the other. They'll talk about one mechanism or this mechanism's shown in this study, but when it boils down, what does the outcomes say? What do the human randomized control outcomes say? And a lot of people hang their hat or get hung up on mechanistic data, whether it's in rodents or people or the like. But you can have a mechanism work all day long, but then you implement it into a human being and it doesn't work. And so we have to understand the difference. And so a lot of that gets mixed in with the explanations of these physicians in their practice with stem cells and exosomes and PRP, and they take one study and they extrapolate one mechanism, and then they sell it as if that's going to help, like the second degree burn approval for the FDA. Softwave works. Look, it's been approved for this, but we're going to do it for this entirely different thing. Well, how do you know it's going to work for that? Maybe it will. Maybe it won't. Maybe the placebo effect is going to help them more than anything else. Maybe it's all the other therapies that they're going to do, and maybe that patient gets better. But was it really the Softwave that did it? So you see where I'm going with that. And then that's with every other modality out there that doesn't have a specific track record of producing that resolve in the research, in the literature, in the randomized control trials, which is the gold standard. Meta-analyses, systematic reviews, that they collect all of those those RCTs, and they analyze it, and they look at the direction of the evidence. If it's not going in that direction, and it's like, sporadic here and there, you get little pockets of things that are happening, but that's just noise, because you're going to have some of that, just like you have the case studies of the dude getting his hearing back, just like you have the case study of Sally having one adjustment and her whole world changed. It happens, I get it, but I just think that we have a better we have an obligation to the public to not do things that are going to harm them first and foremost, and to educate them as doctors, and to provide them with good, sound, reasonable care. Insurances only cover chiropractic adjustments. They don't do anything else practically. They might cover one other modality. They might give you 6 visits. They might give you 12 visits, and then they got to make you work for the other 12 and prove medical necessity. There's a reason for all of that, because the literature tells us that we can get people better in 6 to 12 visits. I'm proof of it. I get people better in 6 to 12 visits all the flipping time. Now I got a 78-year-old little lady that came to see me a month ago, and she had to double down. We did 12 sessions. She didn't quite get much better. She's 78 with arthritis. I said, look, you could do it again. We could add another 12, or you could, throw in the white flag. We can get an MRI and maybe proceed with other avenues like an injection or what have you. She's like, well, I don't really want the MRI. I don't want to know. Can I just do more therapy and see if it helps? I said, you absolutely can. I just wanted you to know what your options
What's
were
out there.
Yeah, so there's got to be a stopping point at that first initial time frame. You just don't go all in, And she was really, she got better. She had radicular pain going down the left leg, and it went away in about visit number 15, 16, something like that. And it came back a little bit, and then it went away, and she's on visit like number 18 now. And so it takes time for some people, but those are the extreme cases. Medicare will approve up to as many medically necessary visits in a year that are possible, but they're only going to approve what's medically necessary. And so they might, in a treatment session for an older individual, they might give you 18, 20, 24, but man, you better cut them off after that. Otherwise you're going to get audited. You're going to be red flagged and your clinic's going to get audited. Why is that? The insurance companies aren't stupid. They understand the science. They understand the literature. They understand that if we're not doing what we do best and well and ethically and really putting our efforts in to get the patient better, well, then chiropractic doesn't work for them. First and foremost, if they're not better, they need to go find something else. Or B, you're just abusing their policy and trying to stretch it out as far as possible. And, not every doctor does that. I'm not saying that that's the case, but ultimately we owe it to, our patients to do a better job.
Wow. I love that, man. I learned a little bit today. I really like the way you put it. We'll have a great conversation after this conversation real quick. But I just want to say thank you so much, Dr. Barton. You're amazing. I love your heart and your passion to focus on the issue and to see how you can help people be better. You can find Dr. Barton at barton-chiropractic.com, barton-chiropractic.com. And where can people find you in your area? Like if you can tell people like where you're at and stuff like that, that'd be great.
I'm in a outside city of Orlando, Winter Park, Florida. Mm-hmm. Really nice suburb of Orlando. And yeah, you can find me on Facebook, Chet Barton DC, Instagram, Chet Barton DC. Website's always good too. But my cell phone's up there. Anybody wants to call me?
Oh, wow.
Shoot me a text, shoot me a call.
I love it. And then I love your passion for what you do, my friend. And Decompression, everyone, make sure that you give Dr. Barton a call. And I hope that this talk on decompression helped. It's not always just one thing. Sometimes it's a couple things that gets the body up and going. I love the fact that you focus on, talking about exercise. Don't hear a lot of people talk about that. And remember, everyone out there, you can get better, but the doctors need your help too. You got to take care of yourself. You got to make sure you put not McDonald's in your body every day and then expecting your neuropathy to get better. Anyways, have a great day and God bless you, my friend.
Thanks for having me.